Welcome to Shennu Media Education Staff Nurse Examination Preparation Questions and Answers Papers. Today we are discussing the Critical Care Nursing Test Paper 3 Part 2. Before that, we have discussed the Test Paper 3 Part 1. This is the Part 2. This is the important session. We are preparing for the OET, SNB, HAD and Prometric examination along with the AIIMS examinations, ESIC, RRB also it is very useful. And who are preparing for the all the competitive exam as a staff nurse, it is very important to helpful and with explanation is there for examination. So watch the till end this video. So it is very important to you and us. The question number 1. A client with angina pectoris is experiencing chest pain that radiates down the left arm. The nurse administers the sublingual nitroglycerin tablet to the client. A client pain is unrelieved. The nurse determines that the client needs to another nitroglycerin tablet. Which is vital signs is most important for the nurse to be checked before the administration of the medication. The correct answer is blood pressure. The explanation of this question: nitroglycerin act directly on the smooth muscles of the blood vessels and causing relaxation and dilation. As a result, hypotension can be occur in this. The nurse would be check the client blood pressure before the administering the second nitroglycerin tablet. Although the respiration and apical pulse may be checked, these vital signs are not affected by the medication. The temperature also is not associated with the administration of this medication. The second question: a client who are attempted suicide by the hanging is brought to the emergency department by the emergency medical services. Which is the immediate nursing action should be taken? The correct answer is to assess the client respiratory status and for the presence of the neck injuries. The explanation of this question: the immediate nursing action for the client who attempted suicide is assessed to psychosocial status. Airway is also priority. Therefore, the assessing the client respiratory status and for the presence of the neck injuries is the immediately action that the nurse takes. Although the remaining options identify the appropriate nursing action, they are not in the priority. Third question: a client is admitted to the hospital 24 hours following an aspirin acetylsalicylic acid overdose. The nurse assesses this client for the which signs and symptoms indicating the acid base disturbances that could be occur in the client. The correct answer is headache, nausea, vomiting and diarrhea. The explanation of this question: the client who are ingest a large amount of the aspirin acetylsalicylic acid is the risk for the developing metabolic acidosis 24 hours after the poisoning. If the metabolic acidosis occur, the client may be exhibit hypnea and hypnea with cumulative respiration, headache, nausea, vomiting and diarrhea, fruity smelling breath because of the fruity smelling breath because of the improper fat metabolism, central nervous system depression, twitching and coagulation, convulsion and hyperkalemia. Shortly after aspirin overdose, that client may be exhibit respiratory alkalosis as the compensatory mechanism. By the 24 hours post overdose, however, the compensatory mechanism fails and the client revert to a metabolic acidosis. The fourth question: the nurse has just received a unit of packet red blood cells from the blood bank for transfusion to the assigned client. The nurse is careful to select tubing especially mode for the blood product, knowing that this tubing is manufactured with the which item? The correct answer is tubing with an inline filter. Explanation of this question: the tubing is used for the blood administration has an inline filter. The filter helps to ensure that particles larger than the size of the filter are caught in the filter and are not infused into the client. Titanium tubing option 1 is correct because of the blood does not need to be protected from the light. An injection port in the tubing or the option is micro drip tubing is unnecessary because of the medication should be not be added in the blood. The tubing should be micro drip, not micro drip. Option 3, tubing with the inline filter allow the blood to the flow freely through the drip chamber. The fifth question: a client with probable minor head injury resulting from the motor vehicle crash is admitted to the hospital for observation. The nurse leave a cervical collar applied to the client in the place until the when. The correct answer is the result of the spine radiography are known. There are a significant association with cervical spine injury and head injury. For this reason, the nurse leave any form of the spinal immobilization in the place until the spinal radiographs rules out the fracture or another damage. The remaining option are incorrect. The sixth question: a client with ventricular fibrillation is about the defibrillator to convert this rhythm effectively. The monophasic defibrillator machine should be sent which energy level of in joules J the first delivery. The correct answer is 360 J. The explanation of this question: the energy level used for the defibrillation attempts with the monophasic defibrillator is 360 joules. The seventh question: the nurse is conducting the basic life support BLS recertification class is discussing chest compressions on the pregnant woman. The nurse should be tell the class that which action should be taken. An advanced pregnancy client whose fundal height is the above umbilicus. The correct answer is maintain the manual left uterine displacement during the compressions. Explanation of this question: according to the American Heart Association current guidelines for the performing cardiopulmonary resuscitation CPR, recognition of the critical importance of the high quality CPR and incompatibility of the lateral tight with high quality CPR have promoted the elimination of the recommendation for the using the lateral tilt and the straightening of the recognition of the lateral uterine displacement. Priorities for the pregnant women in cardiac arrest are provision of the height of the quality CPR and relieve the atroclavicle compressions. If the fundus height is at the above the level of the umbilicus, manual left and uterine displacement can be beneficial relieving of the aortocaval compressions during the chest compression. The eighth question: which should be the nurse do when the sitting of the arterial line? The correct answer is tightening all tubing connection. Tightening all to the explanation of this question: because of the arterial vasculature is a high pressure system, all tubing connection must be tight to avoid the blood loss from the loose connections. The high pressure tubing which is transducer is used, not micro drip tubing. The transducer should be level to the atrium, not the ventricle. Raising the height of the infused is not sufficient to prevent black backflow. The ninth question. The nurse is preparing for the hang first bag of the parenteral nutrition solution via central line assigned of a assigned client. The nurse should be the obtain which most essential piece of the equipment before the hanging the solution. The correct answer is electronic infusion pump. Explanation of this question. The nurse obtaining of the electronic infusion pump before the hanging PN solution. Because of the high glucose content, use of the infusion pump if necessary to ensure that solution does not infuse to rapidly or fall behind. Because of the client blood glucose level is monitored every 4 to 6 hours during the administration of the PN. Blood glucose meter is also will be needed, but is not the most essential item needed before the hanging the solution because of it not directly related to the administering of the PN. Urine test strip measured the glucose rarely are used for because of the advent of the blood glucose monitoring. Although the blood pressure will be monitored, a non-invasive blood pressure monitor is needed, not most essential piece equipment needed for this procedure. 10th question. The nurse is caring for the client with the chest tube who are accidentally disconnect the tube from the drainage system. When the trying to get off the bed, the nurse immerses the end of the tube the sterile water. What is the immediate action should be the take the nurse? The correct answer is the obtain the new drainage system. The explanation of the question. If the drainage system is broken, interrupted or tube disconnects, the end of the tube should be placed in the bottle. Sterile water held below the level of the chest. A new drainage system is the immediately obtained in the setup of the placing of the client into the prone position and asking the client to hold his her breath are not helpful. Placing the sterile dressing over the disconnection site will not prevent the complication resulting from the tube disconnection. The nurse should be also perform the assessment on the client and connect the primary healthcare provider. Thank you. Today we have discussed 10 questions in part 2. Part 3 also is there. We have wait for the part 3. For more videos, like, share, subscribe my YouTube channel Shen News Media Education. Thank you very much. Thank you for watching.